Hi, this is Divya Prakash from nuclearmedicinesolutions.in. In the current series, we are discussing about NABH accreditations of hospitals and diagnostic centers. And this is the third video of that series, which will discuss about structural, procedural, and outcome-related needs of NABH accreditations. This video had 4 parts where in the first part we discussed about what is quality in healthcare. In the second part we discussed about accreditation organizations and their standards, and based on those standards what are structural, procedural and outcome related needs that we are going to discuss in this video. And in the last part of this video series we are going to discuss about how to set up quality indicators. Just a quick reminder of what we discussed in the first part and second part. We discussed what is quality in healthcare, what are building blocks of quality, what is the need of quality, and the benefits of accreditations. In the second part, we discussed about various accreditation organizations across the world and which are there in India, like JCI, NABH and ISO standards. We discussed standards of NABH and their applicability during various assessments. We discussed chapters of NABH standards for hospitals and medical imaging services. So let's see what is there in this third part of the presentation. Before going to see structural needs, we need to see what are statutory compliances for NABH accreditations. The healthcare organization should be registered from State Health Authority or registered under Clinical Establishment Act, that is CMO registration should be there for the organization. It should be registered under Shops and Commercial Establishment Act. There should be consent for Pollution Control Board to generate biomedical waste, MOU with Biomedical Waste Collecting Agency, PCB license for air pollution, PCB license for water pollution, authorization for disposal of radioactive waste, fire NOC, PC and PNDT Act registration. There are some of these compliances which are mandatory in some states and which are not mandatory in some states, that we need to see. Like PC and PNDT registration is mandatory in Delhi for all CT, MRI, PET-CT. The organization should have an RSO, and all AERB related approvals like to operate nuclear medicine facility, license for PET-CT, license for SPECT-CT, approval for high dose therapy, approval for low dose therapy, whichever is applicable to the organization, those licenses or approvals from AERB should be there. And if there is a pharmacy within the premises, you need to have drug bulk license, drug retail license and narcotic licenses. If there is a canteen facility within the premises which sells food, then we need to have canteen or food and beverages licenses. And if you are serving simply tea or something, some snacks which is without any charges, then you need not to have licenses for that. Ambulance is an statutory requirement. If you have ambulance, then it's fine. Otherwise, if you do not have, you should be having an MOU for ambulance with some hospital or some organization which is providing ambulance. So let's see what are structural requirements. There should be bilingual signages, and those signages should have a display of scope of services, and this scope of services display should have what are facilities available, what are facilities not available, what are the timings, and what are the phone numbers, what is email ID, what are the website address. These all the details should be there on the scope of services board, which is outside of the healthcare setup. This is just an example of board. You can modify it as you need, and it should be bilingual. If it is in the north, it should be having a Hindi also, or if it is in the southern states, then the regional languages should be there so that the patient should understand what the services you are offering. The mission and vision should be displayed within the premises. Patients' rights and responsibilities are to be displayed, and that too in bilingual format. This fall prevention posters, hand wash techniques, should be displayed in each washroom. These radiation safety posters for breastfeeding in pregnancy, these all should be displayed, and that too in bilingual format. How to handle emergency procedures, those boards should be there, and of course these all radiation symbols or radioactive symbols should be there at appropriate areas. This license for CT operation or PET CT operation should be pasted outside the room of PET CT or CT. All the toilets should have bar grabs like this, because many patients, they are not able to stand by their own, and those washrooms should be having this emergency call bell system, so that if they are falling or if there is some urgent need where they are not able to solve it by their own, they can call somebody and they can use this. Some of the toilets should be wheelchair enabled, means patient is wheelchair bound, they can use that toilets. This silence posters, no smoking area posters, and fire signages, this is very important. This all should be there in each area, and the most important thing, it should be self-illuminating, means if there is no power supply, they can glow, so that patient should be able to identify and where to rush and come out of the building. Although fire extinguishers should be having a display above those, because they should be seen in the darkness, and the fire exits where the staircases, those all the displays should be there. All the areas should have fire escape plan and this push bar to open on the gates, and it should be glowing during in darkness. All the staircases should be having anti-skid tapes, and those tapes should be self-glowing. See, in the darkness they are all glowing, and patient will be able to make out where to go, because in most of the emergency cases when there is a fire, the first thing is there is shutdown of power, so there will be darkness. So in that condition, how the patient will come out, these all are requirements for that. Let's see what all the documentations are required for MIS accreditation program. There are manuals required to be made, and they are broadly divided in 3 categories like Apex manual, safety manual, and infection control manual. Let's see what are the contents of Apex manual. It should have introduction to organization and organogram, mission, vision, aim, and quality policies should be mentioned in that document. Quality objectives and list of committees. NABH MIS chapter-wise documentations should be there for control of safety, control of processes and procedures, control of environment, control of personnel, control of documents and records, risk control and safety. These all the things should be mentioned in that manual. It should have continuous quality improvement program for verification of processes and validations, adverse event reporting, and quality indicators monitored. And the performance of those quality indicators should be mentioned. At least one quality indicator should be there which relates to patient services, and one for each modality. Let's see what are the contents of safety manual. It should be having introduction to center, the various medical codes like code blue, code red, code purple, these all should be mentioned. The safety committee, the fire safety, electrical safety, radiation safety, equipment safety, medical gas safety, water safety, building safety, patient safety, vulnerable patient safety, geriatric patient safety, anesthesia safety, falls and fall reduction program, employee safety, personal protective equipment, risk management, and sentinel events. These all things should be mentioned in safety manuals. Let's see what are the contents of infection control manual. It should have infection control program, goals and objective of MIS for ICP, MIS infection control committee and their responsibilities, hand hygiene procedures which relates to personal hygiene, injection, oxygen administration, equipment related protocols, environment related protocols which defines high risk areas, water quality, pest control, etc. Employee related protocols like employee health program, post exposure prophylaxis, surveillance and reporting of infection, and biomedical waste management at medical imaging services or at the hospitals of. So these all the documents we need to prepare before going for any accreditation. The document should be there for radiation emergency preparedness plan, radiation safety manual, and various SOPs like how are you going to do infection control, how are you going to verify your reports, how are you going to verify the quality of images, and how are you going to verify your protocols. These all the things should be mentioned in the standard operating procedures. The sample documents you can see on my website, that is nuclearmedicinesolutions.in. On consultancy page, sample of all these documents and manuals are shown there. Just click on any document and it will show what are the contents and a sample of documentations, how are you going to prepare those documents. So you can just visit and see what all the requirements are there. In the fourth part, we are going to discuss water quality indicators, what are the documentations are required for those quality indicators. So see you in the fourth part. Please feel free to write us at support@nuclearmedicinesolutions.in for any feedback or query. Thank you very much.